start. Okay, so hello everyone. My name is Harold Chui, the current president for the Society for Psychotherapy Research Asian Area Affiliate, or in short, SPR-Asia. So today we are very happy to host our second online seminar. And before I introduce the seminar and speaker to you, I would like to say a few words about SPR. So SPR stands for the Society for Psychotherapy Research, and it is an international multidisciplinary scientific association devoted to research on psychotherapy. It plays an important role in providing opportunities to psychotherapy researchers for interaction and dialogue. And SPR also values knowledge transfer and communicates to practicing psychotherapists in clinical practice through the annual research meetings, through our society's professional journal, Psychotherapy Research, through online seminars like this one, as well as other forum discussion boards. So the ultimate goal of the SPR is to enhance the empirical basis of the effective practice of psychotherapy worldwide. So now let's switch gears and talk a little bit about SPR-Asia. So SPR-Asia was formed in the end of 2022. It is the latest area affiliate group in SPR. And as an organization, SPR-Asia hopes to support the development of psychotherapy research in Asia, foster interaction and collaboration between psychotherapy practitioners and researchers, enhance mentorship between trainee or early career members and more experienced members, and finally, to increase the scientific and social value of psychotherapy research in Asian countries. So now back to our seminar. We are very delighted to have Professor Shigeru Iwakabe to give a seminar on case study method. The title of the seminar today is From Clinical Case Report to Systematic Case Study, Increasing the Validity of Case Study Findings. So a little bit about the speaker. Shigeru Iwakabe is the initiator and mentor for SPR-Asia. He is a full professor in clinical psychology at Risumekan University in Osaka, Japan, general vice president, the Society for Psychotherapy Research, and also the co-editor-in-chief for Counseling Psychology Quarterly. So let's welcome Professor Shigeru Iwakabe.
Hi. Thank you so much for a wonderful introduction, Harold. And it's such a pleasure to speak to you about case study research today. And, Asian Affiliate Group is very new. And I'm so happy that there are so many people coming today, gathering and, learning about case studies together. My talk is going to be about 1 hour, but I'm gonna have a couple of kind of little break to ask you, invite your questions, comments. But during the talk, the chat function is on. You can make comments, write down questions in chat anytime during the talk, so that you don't, you can ask them anytime and you don't forget your questions. Okay, so it's an Asian group, and I see a lot of names, different names. I mean, if you like, just write down in the chat where you're from, which country you're from. It'd be really nice to know where we all are from. India, right? Taiwan. Well, lots of people from India and Taiwan, but some people from Sydney, US. It's a very difficult time joining from US. Thank you. Hong Kong, Taiwan. Well, there's so many countries from Canada as well. So that's nice. I hope that we can all meet at some point. Especially, I will tell you at the end of the talk today that in 2026, SPR International meeting will be held in Osaka, Japan. So I hope by then we can all learn about case studies and present your work then um, in Osaka. Or even before that, there are international meetings. So now Harold had much cooler title. I have, for some reason, have a generic title on my page. So I'm going to skip this page quickly. And the outline of today's talk is about, case and case studies in psychotherapy, the role that they played in the development of the field. And then I'm going to move on to talking about how to conduct systematic case studies. So this is more kind of a practical guide. And finally, I will introduce you some of the major case study research conducted and being conducted by SPR members. SPR, even though it is a group of researchers who aim at highest scientific rigor, there are many case study research methods developed by them. So I just want to show you the varieties of ways you can use case study research methods. So now the introduction. The case study. First of all, what's the case? I think the case is one of the most meaningful unit of study and thinking in psychotherapy. We think about psychotherapy in terms of a case, in a case supervision, case conference, in a training. When we are thinking about psychotherapy, in generally, we have a particular client or the case situation in our mind. So this is very important unit. Now, case studies have played a prominent role in development of psychotherapy. A lot of the major theories of psychotherapy were based on a small number of cases. And then also the case has such an important educational value in the sense that clinical learning clinical learning is facilitated when it comes from specific and vivid examples. We don't learn from general abstract rules alone. When it's contextualized in the case, in the specific case, it becomes much rich and a better learning. And writing up a case report, in addition to case conference and the case discussion, is essential to our clinical practice and training. It's a major part of our learning. And finally, I think the case studies are very important because they capture the complexity and uncertainty of everyday clinical reality. I think everything that we do is complex. And also that there are rooms of uncertainty that we have to work with. I think the case studies can capture both. And when we look at the cases, I'm sure you have several important and famous cases in psychotherapy. And many of you know most of these cases. Freud and Anna O, little Albert. And then ethics class, we learn about Tarasov. And then, even though it's not, formal case studies, we know Gloria and the three therapists. We learned so much from discussing who was the best or which one you liked the most. And there's a very interesting book by Irving Yalom called Every Day Gets Little Closer, in which a letter the therapist write to the client and the client write to the therapist are presented in one book. And we also learn from demonstrations. APA has a number of demonstration of approaches for specific populations and specific approaches. And we talk about these cases and we watch and we learn. So just not the cases, but the case studies in general have these strengths. First of all, case studies give rich details and captures complexity of clinical practice. And a lot of statistical methods allow only capturing one point in time, but the case studies allow us to look at changes and development over time, which is very important in psychotherapy. Another one is context and specificity. Um, Finally, by reading the narratives of cases, we are able to integrate more information. So these are very important strengths and the merits of case studies. But also, as you know, the case studies have been criticized for many reasons. One is that, when the therapist writes about the case, there's a subjective bias of
Vehicles side by side, please.
which um, controlled. And then another one is similar to this is allegiance effect or bias toward confirming the theory of the therapist. The therapist try to sort of support the theory that he or she subscribed to. Lack of generalizability is another one because it comes from N of one. And another very difficult thing, and that we are going to discuss, is that there's no systematic data gathering or analytic methods. A lot of case studies, clinical case studies, were based on the therapist notes, which are more arbitrary, what comes to therapist attention and what the therapist remembers, instead of this being systematic. Finally, psychoanalyst Donald Spence called this a lot of narrative smoothing, which is that the therapist choose events and information that's consistent and cut out those ones that don't really fit into the overall story. So these kind of criticism of the case studies have become very, very serious, and the case studies tend to be regarded as non-scientific, and that tendency became even stronger in the current evidence-based practice era. I mean, as you know, that there are many evidence-based approaches these days, and in some countries, these approaches that have empirical support more privileged than other therapies without empirical support. And the whole idea of evidence-based practice is based on the best evidence, which comes from efficacy research, usually known as randomized clinical trials, in which the effect of a single theoretical approach on a single clinical diagnosis is examined in a very controlled environment. You have to have randomization, and you have to use a single approach, usually based on the treatment manual. And this kind of research really emphasizes objectivity and is very good at minimizing methodological biases, but they are not without criticisms. The randomized clinical trials and the ideas of evidence-based approach are, under attack recently because this happens in a very scientifically controlled and rigorous settings. The findings coming out of RCT lack ecological validity and clinical relevance. It's too narrow, it's too controlled. And this kind of research, many people point out, actually end up widening the schism between research and practice because research is conducted by a small number of researchers who have a lot of grant and who can implement this kind of research. Finally, even though they're called evidence-based approach, they're not perfect. For example, CBT for depression is well known as evidence-based approach, but improvement is about 60%. And that goes down quite significantly after 1 year follow-up. And usually we know that there are about 10% of treatment failures and 25% of people who don't get better in those evidence-based approach. So conducting RCT does not solve these problems. We need a more refined approach. Now, recently, the idea of evidence-based approach and evidence-based practice is not a single way to look at evidence. There's a new way of looking at evidence and the practice and the relationship. And one idea that's becoming strong is called practice-based evidence, which is that research evidence comes from real-world, naturalistic clinical settings. So instead of having very controlled research, we can have data from everyday practice, and we can still consider it and use as practice-based evidence. Some people talk about practice-oriented research, and in the focus of practice-based evidence is the variabilities and variation. Depression manifests in very different ways. We want to capture these varieties of ways depression manifests and were treated in psychotherapy settings. Practice-based evidence also address complexities and context, and it talks about effectiveness, not efficacy. Efficacy is effectiveness, but examined in a very controlled environment. Effectiveness is effectiveness in everyday clinical setting. And in this context, systematic case studies are regaining attention from researchers and practitioners. So, but I'm talking about systematic case studies, not just case studies. But what makes a case study systematic? Not just any case studies, but systematic. So one very important thing is attention to case study methodology. It's not just relying on clinical notes, but paying attention to how you gather the data and analyze the data. And then at the same time, going beyond the therapist perspective. It's not just a therapist writing up about a case, but adding some other perspectives, using different and multiple methods, multiple viewpoints, and multiple data sources, and incorporating methodological procedures and standards of qualitative research methods. So these are some of the ways we can make case study systematic. All right, so that's the introduction about the case studies. I wonder if there's any comments you have. Can you hear me well? I would like to switch to the slide mode, but if I do, I cannot see anybody. Or next slide, if this is okay, I will keep it this way if it's okay. Good. Okay, any comments? Everything clear so far? Is it okay? Now, so how to conduct case study, but systematic. Usually when we think about the research, this is a flow of how we do research, right? I mean, if we compare different groups, if we have a questionnaires, and first you identify the topic, you want to look at the relationship between narcissism and depression, for example. You go to the literature and study what's being found and what's the next future directions. Based on those, you create hypotheses. And then finally, you develop research design that's best to address the hypotheses. You describe the population, you decide a sampling strategy, and then you collect the data and do the analysis according to the planned way. This kind of natural progression of research, doesn't really work with some of the case research. Because with the cases, sometimes you have a specific case in mind you want to look at. And sometimes it starts from having a case rather than having a research question. Clinicians often think about writing up a case study because the case is interesting, good, or thought-provoking. And that's why you want to study about the case, right? And then determining a research question without a specific case in mind is not always possible unless you have a big data set from an outcome study and you can choose the case that you want to study. So in the case, studying the case, usual progression of the research procedure doesn't always work. In the case studies, sometimes you work with a completed case, which is on the left. You have a first you develop a conceptual framework, you have a specific case, and you have, new ideas, about the case. Then you go back to the case materials, but the case materials sometimes is not enough. So you go through the patient's notes, patient's files, psychometric, some of the assessment data, and make a full data set, then analyze the case. And finally, you develop sort of case narrative. But with the case studies, you go back and forth these procedures. This is very similar to qualitative analysis because in qualitative analysis, data gathering and the data analysis often are circular rather than linear. Another situation you have with a case study is that conducting a case study on an ongoing case, especially with a long-term case, sometimes you know what you're studying and you have a hypothesis. And based on the hypothesis, you try out, an intervention. And then you examine if it worked, how it worked by analyzing. Then planning a next intervention or way to address the problem, and you monitor change and you repeat this kind of cycle. So in case studies, it's more complex in the way the whole process of research is. But this needs to be somehow more systematic rather than arbitrary. Another thing I want to discuss first is an ethical issues in doing case studies. Case studies, any kind of case study research. Case studies, one of the strengths is that the information that it provides is detailed and very rich. But then we also have a question about the privacy, which is, one of the most important ethical issues. I mean, first of all, in writing, we have to use masking and disguising to maintain the anonymity of the client, sometimes of the therapist as well. Written consent, written informed consent from the client is necessary, but sometimes the consent itself is not enough because after the client decides that, the material can be, is used for the case studies, he or she may change mind. Or some people, after the paper is published, someone from the client's life may feel exposed. You really need to be careful about what implications the detailed information can have. And another ethical question that we need to consider is when to approach the client for permission. Before the treatment, mid-treatment, when you think this case is really good for um, working on certain issues, or post-treatment after the client is better, after the client maintained the gain, or the post-treatment after you are sure that the client is doing well. And then do you get another consent before you submit your manuscript? So there's no single right answer, but these are the consideration that you need to have. And when the client is minor, this is another difficult situation. First of all, if you're a private practitioner, where do you get the ethical approval of the case study? Every situation is different, but we need to look at these in a very, very systematic manner. So how do you start a case study research? First of all, I think in research, any research, we need to determine research questions. And in determining the research question, the most important thing is, do you have the appropriate case, the case that's good for this research question? Sometimes the research question you have cannot be answered by the case you have. And do you have a sufficient data? More than a case notes, not just your impression, but some concrete data. Some of the major question that the people have in the case studies are like, what processes contributed to the change or failure? I'm an emotion focused therapist, so in emotion focused therapy, doing chair works is very important. But how were the chair works implemented over the course of therapy? And they contributed to interim or intermediate improvements. Looking at the changes over the course of therapy instead of just a single session. And, in Asia, many counselors and therapists work in school settings, and they want to look at not just individual therapy or counseling, but the effect of working with the parents and teachers, how to incorporate those extra work in the framework of, let's say, client-centered therapy or CBT. These are very important questions to be, worked in case study setting. So now, another important question in the case study research, I mean, this is also important in any kind of research, is the sampling issue. In case study research, how to select the cases is important. But there are some basic principles of the selection of cases, which is, first of all, choosing a unique case, a case that has extraordinary success or failure, something that stands out, something that's very special. The next one is a critical case. A critical case is a case that provides disconfirmation of a theory or confirmation of some important aspect of theory. Now, another one is exploratory case. It's some case that you didn't expect to get, or some new problems, and you want to kind of look at that and report the details. I think in the medical field, this exploratory case studies are very important. Finally, pragmatic or descriptive case studies. These are not like maybe special cases, but these are the cases that are maybe ordinary or good cases, and you want to capture the process of change. In Japan, case studies are huge, but a lot of therapists choose cases that are personally important. Like this case is my signature case because I really learned a lot from this case. That's really good for training and the professional development of a therapist. But in terms of a research perspective, it is very important that the cases are related so closely to the research question, theories, and those principles of case selection. Um, I'm going to skip just one slide, but I'm going to move on to this. I wonder if you maybe I could take some questions if you have here. I'm
Yeah,
going.
there's a question. What is chair work?
Uh, yes, the chair work is it originally started in psychodrama. There's empty chair, two chair work, and psychodrama, and then imported into Gestalt therapy and emotion focused therapy. But empty chair work is, for example, imagining someone important, like your father or mother, sitting in a chair and speak to the chair to express the feelings and emotions that were not expressed before. And it is a method for emotional exploration and completing past unfinished business. Even though it's mostly used in emotion focused therapy, in some Gestalt therapy and in psychodynamic therapy, they are also used.
Yeah, I have a question about the unique case, like the failure case, right? So I think it goes back to the ethical points about needing the permission from
Right.
the client. So I imagine that would be really, really difficult and or anxiety provoking for the therapist to, think about writing it, but at the same time needing permission.
Hmm. Right. I think that's a very important point. I mean, first of all, if it's a failure case and the client dropped out, the client may never want to hear from the therapist.
Yeah, yeah.
And it would be, very angry or upset. But at the same time, learning about treatment failure is very important. And
Mhm.
sometimes the best way to study treatment failure is through a case study by learning a very specific context, the match between the therapist and the client. And so this is a very, very important, but at the same time, ethical issues also come in to play. I think Harold disappeared, or is he in? So even though I think that the failure cases, um, ethical issues can be problematic, but it doesn't mean that you cannot study it. In many situations, the therapists have written about the failure cases without the permission from the client, but with the best ethical mind and consideration. Okay. Any more questions? Any, Harold, I'm sorry, I finished.
No, 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 that's fine. The connection
Yeah.
dropped.
Okay, any comments, questions? I mean, you can speak up, or you can write in a meeting chat. Okay, so I'm gonna go forward. Okay. Oh, all right. I have a question. Difference between efficacy and effectiveness. Can you explain? Yes. I spoke about the randomized clinical trials. It's often referred to RCT. Randomized clinical trials are efficacy research in the sense that the efficacy is outcome of psychotherapy or effectiveness of intervention in a very controlled way. You have a group of depressed patients, you divide them into a control group, contrast group, and a treatment group. And one group get the treatment, the other get waiting list or placebo, and you compare in a very rigorous way if the treatment is effective to establish the causality of between intervention and improvement. That's called efficacy research. Effectiveness is not about the controlled situation, but it's if the treatment works in everyday clinical settings. So it's not about comparing the two groups of the patients. I think that would be, the difference between the two. Thank you. I have a question about coming up with a research question. Is the process different from ongoing cases compared to completed cases? Yes, I think, well, there are overlaps, but I think the research questions get sharpened as you go back to the cases, case material, and I think that in the case studies, research questions are usually sharpened and refined as you examine your research questions. And sometimes they change as the case analysis go forward. And this happens also in the qualitative research. But are they different? I think so, because with the completed cases, you have a very limited sort of definite sort of a set of data that you cannot increase or change. Whereas with the ongoing cases, you have more opportunities for getting the data. So there are more flexibilities with ongoing cases. That's a good question. Thank you. Can we conduct case study research on the clients who seek therapy through online mode? If yes, what would be the guidelines? Yeah, this is a very important question because, the two major outcome research that I do are mostly online. And online therapy, because the Zoom allows you to videotape so easily, if you can videotape, you have a very good data set. But of course, you need to follow the guidelines, and sometimes with clients you're meeting just online, you may not have a good grasp of the client situation, and ethical responsibility, ethical kind of consideration have to be given special attentions. But usually, it's not so different from in-person research. Thank you. Okay. Let's answer one more question. Is the measurement of outcome in the different types of case study carried out by the therapist or an independent rater? Now, I'm going to talk about it later on this subject, but in case studies, it's better if you have a multiple perspectives, multiple measures, or different ways to demonstrate the outcome. Oh,
There's
Robin,
a
of
hand. Yeah.
Yeah, Professor, can I ask a question?
course.
Yeah, I am thinking about when you mentioned how case study becomes systematic, and then my initial response inside myself is, what systematic you meant, because it could be the researcher's systematic exploration, and it could be the discipline, this in that discipline, that research could be systematic, or it could be our uh, res our research subjects systematic, and it could be also the methodological systematic. But from what I heard so far, can I ask you, you are talking about how a case study becomes systematic, am I right?
Yes.
Because I need to really zoom in and then to catch what you would be saying. So it is about how a case study becomes systematic. It is not about whether our research is
Right.
a systematic research in the discipline or whatever.
Yeah.
Right?
Yeah.
Okay, thank you.
Yeah. I think you have a really great point, important point, because I think that when I use the word systematic, I included, a lot of things, but I didn't really articulate exactly what are the essential, components of systematic. But in case study research, uh, you know, people talk about it's a disciplined pursuit or inquiry in the sense that the engagement of the therapist, examination of the case materials is not arbitrary, but always have a critical and reflective perspective in it, in the sense that the researcher is always, examining the biases, um, trying to monitor any kind of biases or inferences that are not supported by the materials. There's an aspect of the researcher's engagement or the attitude towards the data. I mean, that's very important. But I think in all aspects of research, from selection of the case, selection of the method, uh, you know, uh, gathering of the data, analysis of data, we use we are not just using the therapist intuition, but we follow a consistent and some logical um, system external to therapist intuition. I think that's what I mean by systematic. I mean, first of all, it's not arbitrary. And it's not just like, your clinical intuition. But, it'd be great if we could develop what makes the case systematic and really articulate, that that part. Yeah. Okay, that's a very good questions, and it'd be great to talk more about it. But now I think this is, also concerns Robin's questions. I'm going to go forward from here and data sources and gathering. I know that a lot of clinicians, the access to the data is limited in your hospital, in your schools. They say no recording or no questions, no questionnaires. But it's very important that the therapists are able to go beyond the post-session notes. And, the process note and reflections are important and useful, but it has to be systematic and rich. So it's not just a few lines after the, session. Next, I think that the important and very useful to have videotapes and audio recording of sessions. because you can go back and go back, and other people can also see what happened. The third, interview with the client, significant others, and other professionals. We had a question about the outcome, right? And sometimes it's good to have the client saying, I feel better, I'm doing all right. But maybe the teachers or families, they also see it that way. And then also the questionnaires, outcome process ratings. And in our research, we used the diary by clients. We had clients write about their experiences. And, finally, if you have audio or video recording, you can make transcripts and you can rate client and the therapist actions. I think in terms of the data gathering, we want the richness and we want the multiple perspective and the multiple sources as much as possible. So maybe this is difficult, but let's talk about it later. Another important thing that makes a case study research systematic is having a research team rather than a single therapist doing everything alone. A research team, could be 3 people, 2 people, 5 people, but it's important in looking at the cases, having a group of researchers working together in order to balance the biases and the subjectivities. Because by having more perspectives, we enhance the reflexivity. We can triangulate, different views and testing alternative hypotheses and interpretations, which can be difficult if you're just looking at it from the same angle. But we also need to be careful how we make the group, because the composition of group members can affect what can be found. Because if there is a hierarchy between group members, you may not able to speak or feel like you're criticizing the therapist if you just say something honestly, especially in the case of therapeutic failures, right? You may choose a group of the same theoretical approach, which may allow you to get deeper into understanding. But if you have a group of researchers of various orientations, you may be able to, have less kind of overlooked understanding and hypotheses. A group of graduate students can work on the data, but if there is a group of very experienced therapists, their conclusions might be different. So even though the research team is important, how you form research group can affect what you can find. So now, how do you select the sessions, segments, events for analysis? Sometimes the, case studies is really the only way to study psychotherapy because you have 4-year long-term therapy. In that case, you do need to choose which sessions you focus on. But how do you choose? Now, looking at all kinds of case studies, it doesn't look like there is a single good principle of selecting segments or sessions for analysis. But I think it is the best that decisions are made in relation to the research questions and based on consistent rules. For example, if you have the client or the therapist post-treatment interview available or the questionnaires available, then you can choose these sessions. You can also base your decision on alliance ratings and other kind of ratings and scores, but it needs some kind of rules rather than just choosing it because it's really the greatest example of this case, or you love the segments. They need to be balanced, and this is very difficult. Finally, in terms of data analysis, I think it is very important that, this case study research often is similar to qualitative research in the sense that deepening the understanding of the whole case allows you to, discover more about the cases, and your understanding becomes more full and less biased. In order to do that, you need to repeatedly watch session recordings or go back to the session notes and have that whole, treatment in your head. It's called data immersion. I think that's very important. Often discussing about the case materials with research members is very helpful. Supervision, of course, is very helpful. And also, because there's so much data, you want to sort of shrink the data or condense the data or pick up some highlights by graphically displaying a quantitative data, making graphs, tables, figures. These are good strategies to get the overall view of the treatment. Another one is creating case narratives. You summarize a session in making a narrative, and this becomes a secondary data. And if it's a long-term therapy, you want to make a summary of several sessions of treatment phase. And then, going back to all these case materials, you highlight the change events, developing hypotheses, and also creating extensive notes. In qualitative research, this is very important. You make hypotheses, make inferences, and you just write them down. And testing whether these are actually supported by the data. In the data analysis, the formal data analysis, instead of just looking at the data from your clinical point of view, you want to use a particular method of qualitative research, grounded theory, consensual qualitative research, thematic analysis, conversation analysis. They are all similar and different. I think it's, I think your knowledge of these methods is, first of all, the most important, and then which one works in particular situation, depending on the nature of data. And in terms of data analysis, what's very important is monitoring if the analysis is good, valid, makes sense. And there's something called triangulation in qualitative research, which is checking one analysis or one data source against another. In the case of case studies, you sometimes present your results to your client, a fellow researcher, or clinicians, and ask if your case analysis is valid, and that's triangulation. And also really exhausting alternative arguments and interpretation is another important thing you can do. Writing up case study papers. In some institution, obtaining a signed publication release from the client is necessary. But sometimes the client says he or she doesn't want to see it. Sometimes it's little too much for the client. What's best for the particular case needs to be examined by case. Writing up a case study paper can be difficult, but by presenting it in a case conferences, you have a better view and balanced perspectives. Masking and disguising is very important, as I mentioned before. And the one rule of thumb is, can someone who knows the client identify who she is or he is based on the case description is important. And you want to change the pronouns and some specific information, but you want to also make sure the main themes and dynamics are unchanged. All right, so that's about how to do the case research, and I'm going to move on to case study research in SPR, but just take a couple of questions if you have, because that's already a lot of information.
Professor Robin here again.
Okay.
Yeah, when you mentioned analysis, you didn't mention narrative approach.
Mm-hmm.
Can I know why?
Oh, narrative analysis, you mean? No
Yes.
reason. I think I missed it. I missed it. And the narrative analysis, there are varieties of narrative analysis, and there are also, um, effective data analytics strategies. You're right. Thank you.
Okay, thank you.
Any comments, any questions if you have? Okay. How do we mask client information while using video recordings of online sessions? Well, I think it's very important. When we use the video recordings, for the data analysis, we first have to educate and train your group members to, how to deal with the confidential information. But we don't usually mask the client's information on the videos, but the videos are, kept in a safe place and only watched, in the lab or in a specific place. But when we make transcripts, we delete all the personal information. And when we analyze the content, we use the transcripts. Yeah, that's very important. Yeah, thank you. All right. Any comments, questions?
Just a follow-up with that, right? Do we let the clients read over the manuscript, or at which point do we ask them to read the transcript or the manuscript? That's something that is on my mind all the time.
I mean, in the qualitative research, when, you are doing research, I usually give choice to my client whether they want to check the interview transcripts or not. Because, sometimes, I sometimes look at the transcript of my interview or me speaking in lectures. I'm shocked because I'm all, saying, and, half of the things I say are meaningless or something.
Mm,
When you show that to the client, they don't like it, and it's too much for them to have to correct what they said.
mm.
So, but in the case studies research, you don't give the transcript, you basically give the manuscript.
Okay.
Sometimes giving manuscript is not the best thing.
Mm,
I think that you need to discuss it and, do the best situation for a particular client. Um, I think that, sometimes the client feels, I mean, valued by being in the case study, and some clients feel devalued by dense theoretical discussion that followed.
okay.
It's too complex and too complicated.
Okay.
But
So there's no rule of thumb or the same rule that applies for everyone.
right, I mean, if you want to give a client the manuscript, it's best if you take time to sit down with your client and answer questions and explain what's in there.
Okay, thank you.
Great.
So I had one question.
Sure.
So if we're sitting with a case and we're reflecting on it, quite often as a therapist, I might become aware of my own countertransference reactions, or if I'm very honest, there may have been times I didn't believe what the client was saying, or I was impacted in various ways, and that will come into the manuscript as well. So one is that, how much of that is meaningful, and the other is my client is going to then be aware of all those things, which we know is part of the process, but I would be a little concerned about the impact on the client as well.
Yes, yes. You see, that's the, kind of the consideration that we need to make. For example, in client-centered therapy, more because of the nature of its theory, you may be more transparent in terms of how you feel about your client. And, there's a lot of empowerment that is a part of, theory and the practice. Whereas with, psychodynamic, but more interpersonal, maybe the, approach in psychodynamic, a lot of countertransferential reactions need to be there and examined, which may not be so easy to digest for the clients after the treatment. So in each therapy, I think that, the degree of transparency of the therapist's internal process is probably and should be different. I think that's interesting webinar that we could do, about how much therapists write about the internal process. Yeah. Thank you. That's so important. All right, I'm gonna move on and briefly describe some of the major kind of case study work in SPR. And SPR is and the psychotherapy research, its main journal has abundant examples, wonderful examples of case study research. They developed the new methods of case study research and also use the case study methodologies very creatively as a part of a larger research project and combine the quantitative and the qualitative methods. And they have also a series of case studies, contrasting two cases and multiple case studies. So a lot of varieties of case study research. One example is Hans Strupp. He has developed something called a single case comparison. He compared two similar cases with markedly different outcome, meaning success and the failure coming from the same therapist dealing with two very similar clients. So this kind of case comparison allows what contributed to success and the failure in a very, very focused way. Another very important and interesting work is done by Lester Leborski and his many colleagues on core conflictual relationship themes. This is a coding system based on the transcripts, identifying the client's wish and response from others and response from self based on his psychodynamic theory. And it sort of predicts the type of transference and the counter-transference and the changes in the relationships of the client. And there's a very interesting special issue in psychotherapy research in 1993. It's old, but it's very new. 7 different ways of studying transference-related measures were compared against a single case, with a transcript also available on this volume. So you can look at the different ways of studying transcript through single case. Another prominent case study, but all kinds of researchers is Clara Hill and her systematic multiple case studies. The book that I presented, this book has 8 cases of brief psychotherapy, very detailed microanalysis of each therapist and the client response, um, coded by her scales. It's an integration of a quantitative and a qualitative analysis in a very detailed manner. She also uses case studies, series of case studies to demonstrate illustrate her theories. Another important work on case studies by Dan Fishman. He has this idea called case studies within psychotherapy trials. He recommends taking a case out of outcome study so that we have quantitative outcome index very clearly demonstrated. Then look at the specific case and so that we get the very clinically rich information. But he also has a journal, later I will describe, but pragmatic case studies in psychotherapy, which is on the internet, which is available widely. So, in terms of what case study can be, how case study can be presented, he has a wonderful example. Host Cashel, he has developed a lot of case study. He conducted a lot of case studies on psychoanalytic therapies, on the long-term psychoanalytic cases using a variety of methods. And this book is a good example of his work. Another important case study method is by Bill Stiles called theory building case studies. He says that the case study allows testing multiple theoretical statements, detailed case examination, and better than statistical testing. And his work is very influential. Another very different and interesting approach to case study is by Ron Miller and Robert Elliott. But he has a research called Real Clinical Trial. He made a mock court hearing with several people arguing for and against the therapy worked and called it the Real Clinical Trial. This is a judicious approach to case study, which was made into a systematic method called hermeneutic single case efficacy design by Robert Elliott. He says the use of comprehensive data. By using comprehensive data, you can establish the causality between treatment and outcome. And he calls it the quasi-judicial approach. I hope you have a chance to read it because this is a very interesting approach to evidence. 2 more approaches that I want to introduce is by Joseph Silverschatz and John Curtis on case formulation research. They say that the outcome of psychotherapy can be only determined by good understanding of what this client needs. So outcome has to be decided not just randomly based on the standard setting, but particular personalized for each client. And they developed a method called case formulation research. And speaking of case formulation, I think that one of the strengths of the case studies, formulating a case formulation for a particular client and seeing what kind of intervention works and is necessary. So Tracy Eels has a book which present a variety of case formulation methods, which would be very useful if you're developing case study research. Just 2 more things I want to introduce and end my presentation. There's something called single case archive on the internet where they gathered over 1,000 case studies, and you can search case study published in English so that when you need an exemplary case for your practice, you can choose case that's similar to, the case that you're working with. This is very important development. Another one is John McLeod. He has a lot of books, but one of the books is called Case Study Research, published in 2010. It's a very user-friendly case study method book, and that's very handy. And, I'm just writing down, there are many other case study examples, great examples in psychotherapy research and SPR, innovative moments, emotion-focused therapy, and also long-term therapy case studies by Helge Ronestad and the University of Oslo group. And another special issue that I want to introduce is the one case, multiple measures. This is intensive case studies comparing different 4 approaches using a case of emotion-focused therapy. It's 2008. I hope you can find it and be able to download. I'm going to skip a couple of things just to introduce you some of the case study materials. This journal called Clinical Case Studies, and this is some of the articles can be you can download freely from the internet. And this journal focuses more on evidence-based practice and evidence-based approaches. So the case materials are quite different from 2 other journals that I'm presenting. Another one is called Case Study, Pragmatic Case Studies in Psychotherapy. This is a web journal, and you can download all case studies free, which is quite amazing. And the case studies are very detailed, and you can also read the comments by other prominent psychotherapists. Finally, APA journal called Psychotherapy from Division 29. They have a section called Evidence-Based Case Study. And they present a lot of cases, detailed analysis, new methods, and you would find very interesting. Finally, SPR has interest group on case study. You can also look at and join. Really, finally, we are planning a meeting, international meeting in Osaka in 2026 in Ritsumeikan University in Osaka. Osaka is only 20 minutes from Kyoto. So it's a good access, and I hope you can join. All right, I'm a little bit over time, but I presented most of my materials. Thank you very much for listening and questions. We have now more time for discussion and question.
Yes, thank you very much, Shigeru. And I think we can open the floor for questions. If you have questions, you can open your microphone or you can use the chat box. So there's a question here. Can you recommend an observer rating scale for the psychotherapy process?
So I would say that there are over 100 scales that are available. And the book, research method book by Hepner, Kivligan, and Wampold called Research Methods in Counseling. There's a chapter which lists a lot of scales in the book, in the research method book. But I would also recommend that you visit Psychotherapy Research, the journal. There are many journal articles that you can download freely, and you will see the scales that are used now. Some of the research scales come from 1960s and 70s, and they are still used because they are useful and valid.
Yes. Any other questions or
I,
comments?
yeah, make the material available, PDF.
One question oh, is there a question? Yeah.
Uh-huh. Hypner, I think Keith Lee Gun 1 point. I'm not sure the exact title, but that's yeah. Okay.
Yes. So next question. Do researchers or therapists often share the manuscript for ongoing clients since the contents might impact the dynamics?
Right. This is another very interesting situation. Sometimes the therapist want to um, publish a case study while the treatment is still ongoing because the client is coming to the therapy or the counseling, but in a very stable conditions and the major crises are over. I think this is also, it depends, if the client would want to see it. And also if you, in the case that you want to publish it, there should be a great reason for you to do so. Like it's so important to publish it now because if this work is not published, the field will be in trouble. But if it's for your personal reason that you need to have a publication, I think that should be avoided. But I mean, this is not always a clear-cut case. But what's good for the field, what's good for the client are the most important question.
Yes. Any other questions?
Comments?
Yes,
Oh,
Professor.
Uh,
Thank you for your talk. And you came to our university, I
yes,
think last year.
yes, yes,
Um, and
yes.
you presented your process with your client. And I always have a question about how we make sure that our research participant knows the impact of our research.
Yes, yes.
Like especially like you travel to many countries and they may not know that many people would see them.
Hmm.
So normally, what kind of measure would you take
Hmm.
to really make sure they know the impact, especially if the topic is really very private and taboo and stigmatized? What will we do? Thank you.
When we have a consent in our research, we have a consent for using the data for research and using the data for also training in a professional context. So the client marks sometimes just for the research, or many clients in research actually do say it's okay to be used for the training of professionals. And I show those videos of the clients who agreed that their videos can be used for professional trainings in where the ethical, I mean, the confidentiality is maintained. And some clients are very cautious about, them shown to the world. But also, I'm also surprised that some clients are very happy that their suffering and troubles can help many other people and also educate therapists. And, this whole idea of respecting the privacy is very important, but also it is important for me as a researcher and the therapist to say that your contribution to the research is so immense to the field, because it really is. I mean, it affected you and you remember. So I think that the ethical responsibility being balancing the two and informing the client both the benefits and some of the demerits of research and also allowing the materials to be used for training and education.
Yeah, but because now, the internet, the social media is so fluid. So if after we finish our research and then it's get uh, published in a written form, and then we still want to disseminate our research, we show the recording. Once they realize the impact, and if they
channel for the Society for
Yeah.
Sorry.
and if they cannot take the impact, can they still retrieve their consent? And then as a researcher, I suppose we need to respect that boundary. Is that right?
Right, right. This informed consent, there's one statement saying that any point in research you can retract or you can quit your research and we don't use your data. But and also usually in the consent it says that the data is kept for 10 years. But I think that in the case of case studies or the materials, recently, I don't know if you know, but the book by Gloria's daughter was published, right? But that single therapy session that were made public affected many people in many years. And as case study has an impact when it's published, but many years later, we don't know how it's going to impact the client or the people around the client. Um, I mean, this is a difficult issue, and I think important thing about it is that we do the best way to protect and inform
Yeah.
mass
So yeah.
guising.
Can I clarify that? I mean, during the research process, yes, the consent is guaranteed. But once our research get disseminated, what would be the boundary?
Oh, for example, if your clients wanted the paper to be retracted.
Yeah, or don't show my video anymore,
Hmm.
like that. Have you ever encountered?
Hmm. Yeah, I think that you would have to not use it if the client, wants to retract the data. The client should be able to do that anytime. Also,
Mhm.
but the Don Fishman, pragmatic case studies in psychotherapy is on the internet. All the case studies are on the internet and you can download, but it hasn't had any problem of that sort in last almost 20 years. And the case studies that are published in that journal, web journal, is very detailed.
Mm-hmm. So thank you very much for the questions and answers. I think we are about out of time, but before we conclude, I really want to thank Shigeru again for taking the time and giving us this seminar on a lot of rich information on this very rich method that I think all of us, especially practitioners and researchers, both can really learn a lot from the method itself and also from the findings. I really appreciate all the different journals that Shigeru introduced, and the many SPR members actually did all the different case study methods, introducing new ones to the community and see how we can use them. So thank you very much. So before we leave the meeting, I would really like to ask people to complete a survey. So basically, this is a survey getting some feedback from you about today's events, but even more importantly, is for us to know what kind of topics you would like to see in the future if we were to organize events like webinars or seminars like this. So feel free to complete the form. At the end of the form, I also have a little question. If you are interested to stay in touch and become a member of SPR-Asia, please indicate your email. It is free and you do not have to be part of the main SPR to join. So it is really a chance for us to stay in touch with you and inform you of upcoming seminars or webinars that we organize. And so this is a very new group, and we hope more people can be engaged and can get connected. This is also a way for us to brainstorm and perhaps get into collaborating with each other. So thank you. Any comments or further suggestions? Oh, before I forget, there is also the video will be posted on the SPR channel. So I'm just sending you the link to the SPR official channel for on YouTube. So if you go into this link, you can see actually there are many excellent videos on psychotherapy research by researchers from all over the world. So feel free to browse and get to know SPR a bit more. Okay, so we will have our video posted on SPR channel as well.
Could I mention just one thing?
Yes.
In terms of my experience in editing the Pragmatic Case Studies in Psychotherapy Journal, one source of case studies that's been very productive is the dissertation, particularly the doctoral dissertation in clinical psychology. If you think about it, you have the resources to be systematic. You have to put the case in theoretical context, and you have the research team that Shigeru was talking about, where you have the committee chairs and the supervisor. So I'd like to encourage people who are thinking about a dissertation or a master's thesis to consider doing a case study, and it has a very good chance of getting published if it's well done.
Yes, thank you, Dan. Thank you, Professor Fishman, for joining us all the way from California. So, and of course, this is an excellent tip for the student audience who is, thinking about completing their dissertations or master thesis. And, case study is a really rich process where you can learn a lot. And there's, now we know there's a potential outlet there. Thank you.
Let me also mention the latest issue
Yes, latest issue then.
of the journal, which just came out, is a dissertation. So, and there are other dissertations. So there are lots of models of dissertations in that journal that students can look at as they're thinking about planning their projects.
Excellent, excellent. So yes, feel free to take a look at the journal, and it's free access online, right? That's right. So
Yes.
thank you.
Thank you for this late hour, Don and Claire.
Good to see you.
See you.
Okay, so I think this is about time. So thank you once again for everyone's participation, and I look forward to seeing you again in the next event that SPR-Asia organizes. Thank you. Have a good weekend.
Thank you.
Bye now.
Bye-bye.
Bye.